A very good afternoon, and the Minister has officially launched the motorbikes that will be used to help navigate the rural province of the Eastern Cape, which in some areas they would have problems in terms of having ambulances getting access to far-flung communities in the province, saying that these motorbikes will help in that regard in terms of transporting those patients that need to be brought to points where ambulances are and getting an immediate and urgent medical attention. A concern, though, is that the number of people who have been admitted in hospitals has increased in Gauteng, Cape Town and the Eastern Cape. Yes, of course, the Minister mentioning there that they did anticipate the rise in numbers, the increase in numbers, but the rate in which the numbers are raising is called for concern. But I'm joined by the Minister, Dr. Zweli Mkhize, now to talk to us about how best then will they be dealing with this. Doc, thank you so much for your time. The number of the infections, those who have been admitted, has increased. I know the Eastern Cape has also, you were happy with the field hospitals. But looking at the number of beds for high care and ICU, do you think they'll be able to cope for the peak period?
Well, the numbers of beds that have been created in the Eastern Cape, the high care beds, the ICU, are actually quite encouraging numbers. They are good numbers, and so I'm happy with that. What we are then saying to the Eastern Cape is that excuse me, is that despite the fact that they are not yet full, despite the fact that some more beds are still coming on stream, we're going to revise the numbers upwards. And so that work will happen even before the current beds are full. So we see the numbers are increasing. We have no way reached the capacity of the hospital, so are not overrun. We still actually have enough capacity. There are more beds that are still being created. I was in Butterworth Hospital and looked at how new additional hospital beds are being put up, how new high care units are being put up. I was in Umtata, and again I found that this in Tata Hospital, the same is happening. So all over the province, the same work is being done. I've been to various other hospitals before, and we saw that this is happening. So our approach is, we made certain projections and we asked for certain numbers of beds. So those numbers of beds are actually being commissioned. So I'm happy with that. But when we look at the numbers, we must always be ahead. So when we now look at the numbers, we want to make sure that we up the game. So we will be increasing the numbers again.
And when you look in terms of those projections, because the province is saying they dodged the bullet of expecting 6,000 deaths during the peak period, and that they're now expecting around about 1,200. When you look at the work that is being done, do you think that really they'll be able to do that, especially with the easing of the lockdown as we move and open for the economy?
Well, it's a nice point to make. You talk about dodging the bullets. With COVID-19, there's no one bullet. There are many bullets. So the first bullet we dealt with was on the imported cases. We were able to flatten the curve. We stayed low for most of the provinces for a long time. Now we're trying to get back to easing the economy. Things are going to happen, so more bullets are going to come. So we have to dodge those as well. Even if we succeed, later on something's going to come. So in other words, the COVID-19 is going to be a surge that's going to keep coming at us. At each one time, we must keep fighting back. And so what they have done up to now has actually made sure that we don't really have a pressure of hospitals that are full, that can't cope. We don't have that. What we have is that there are new beds that are being commissioned. And then what we're saying is that looking at the way it's coming, we need to up the game. So we'll increase the beds. And as we look around, we believe, therefore, that the biggest effort has to still go onto the containment and ensuring that people, are using the masks, they're using distances, and so on. So those issues will always be with us all the way. So that balance means that there's a continuous fight we must end. And people must never think we're doing a once-off fight. Oh yeah, we said to flatten the curve with the lockdown, so what's the problem? No, that was just one part of the battle. There are many more battles that we have to still going to face.
And speaking of the battles, lastly, Minister, the issue of delays in terms of test results, it sort of prevents that moving with speed you were talking about in terms of contact tracing. How do you deal with that when the province, there are shortages of mixers in laboratories and therefore causing the delays?
Well, there are two issues which we must try and separate. Firstly, is that there are certain protocols of how you deal with people who are suspected to be having the infection. The approach is to be, with symptoms, you have to test them, you have to isolate them, to quarantine the contacts, and so on. So we've gone all out now to involve the whole community to just get a sense of how big the problem is. As we're increasing the numbers, and today we've actually gone above 1 million tests, which is huge amount of work. And I really want to reiterate my appreciation for the work of the laboratory workers and all the health workers in general, because they've really put up a real big fight here, and it really makes me very proud. However, we then didn't anticipate the level of shortage, global shortage that we came across. So we've been really hoping that we can now change the focus. And the focus is we're going to target the testing so that those who need immediate attention, those who are under care, those who are under investigation, those who need to be returned back to work as health workers and so on, then they will be actually classified for quick response. The others will continue to clear them separately. We have actually already done that in the Western Cape. We've actually reduced for the patients in hospital to a 24-hour turnaround time. We've reduced the backlog to less than 3,000, and we, as far as we would, because now we're focusing on the Eastern Cape, which is where our real major issue is. And we do that every now and again. At the beginning, when we had the problem which really arose in the Mangaung area, we took all our resources to go and clear that place. Even now, when their backlog came up, we actually cleared it. Now they might be building up a little bit of a backlog again, but we do targeting. So we have now sent a strong message. When it comes to patients under investigations who are admitted, those where doctors are waiting for the results, speed up those results. And therefore that now is going to make it easy to ensure that there's no clinical management that's compromised. At the same time, we've made a public pledge to the public to say, we'll come forward, we're going to test do your specimens, they must be cleared. And so everyone must know what has happened. But in the meantime, we've also encouraged our clinicians to say, because they are in charge, they would then be able to take a clinical view of the patient. If they think that someone was taken out because they were waiting for the test, but then they've been in quarantine for 14 days, then they can actually discharge the patient without any risk to anybody, because that person has been symptom-free but in quarantine for 14 days, so that makes it easy. And those who are on treatment in the hospital and they get better and they've been in isolation for 14 days, then of course there's no need to worry about them. And so the clinicians are able to manage that situation, and I'm quite comfortable with their expertise on that.
Minister, thank you so much for your time. Minister Dr. Zweli Mkhize saying there that they're robbing in everyone really to try and fight the invisible enemy. It would be important also saying there that health workers need active protection. They need to be trained. More training needs to be done in efforts to deal with the anxiety levels that are there in society, that are there in health facilities, where health workers are complaining, where they panic when there's one of their colleagues who has tested positive and they want the hospital to be closed down, saying that proper training, proper protection needs to take place going forward, especially now that we are moving towards the peak period in the next 3 months. But they're robbing in everyone from traditional leaders, general practitioners and specialists from the private sector, so as to join the fight against the COVID-19, and that they continue to increase the number of beds and filled hospitals to prepare for the peak and for the worst. Of course, those motorbikes that has been launched, that will also be part of the fight against the pandemic. We'll be keeping you up to date with the developments that continue to take place in the fight against coronavirus in the Eastern Cape. But for now, it's back to